Well, hello, Lee. It's a pleasure to have you on the show today.
Hi, Tamara. Thank you so much for having me on the Tikambe show.
You have heard about Tikambe?
Yes, actually, I was aware that it's a radio program and that they're dealing with sexual reproductive health issues and basically giving youth information and starting those very important conversations that I think we all think are something that needs to be discussed. And yeah.
Yeah, very rightly put. Sorry, I haven't said what I do. I actually work with young people as well. I'm a social worker by profession and a comprehensive sexuality education trainer. I've been doing this for the last, I think, almost close to 5 years, working with young people to be specific, but a wider sector in the public health sector around the country. So it's definitely still very great to be part of this show as well. And like I already indicated, it's great to be discussing this with you because I did view a short clip of one of the discussions you had with a fellow young person on Facebook, actually, just before getting onto the show. You were discussing something that really is personal with them around their reproductive health and specifically also some gender issues came up. That's quite encouraging what you do.
Yeah, I mean, I think it's important with your friends and even with your family, and for me especially talking about gender and things like that with people who are in my life who are females, because I think it's important to open the door for that conversation and just be honest and truthful with each other.
So you are some kind of a role model.
I'm more like a real model. I make mistakes. I'm not perfect, but yeah, I try.
But that was really good, brilliant and encouraging. Okay, so part of the program today for Tikambe, I'm sure like you've already highlighted there, we are certainly in line with what Tikambe does, dealing with issues that affect adolescents, reproductive health, and also trying to get the right information to the young people out there accurately and timely. So as part of our discussion, we'll also be viewing a short video clip. I haven't seen the video that we are about to see as well. I'm seeing it for the first time. And it's going to help us center our discussion.
Okay, can't wait to see it.
I'm Felistus Chisolo. I'm a student at Evelyn. I'm doing library information science. So a few months ago, I started feeling some strange feeling, and it went on for weeks and weeks. So I kind of got worried, like what was really going on, because I wasn't sexually active. I was just leaving, and then I tried to Google up the symptoms, what I was feeling. So I just tried to find out what was really going on with me. So I Googled out some stuff, and then what I found was kind of relating to cancer, cervical cancer. So I really got scared being a 21-year-old girl and then hearing what I've heard about cancer, and I literally know anything about it. So I really got scared. Then I decided to go to a clinic just to go find out and do some examinations on me, and what was really wrong with me. So I went to the hospital, to the clinic, and the nurse that I found in duty was so rude. I explained my situation to her, but all that I got from her, I was expecting her to like shed more light on what I wanted to hear about cervical cancer and the dangers, the symptoms, and how I can prevent it. But all I got was I can quote what she said. She was like, "This generation." Youngsters of nowadays, you don't do the right things. You're always indulging yourselves into sexual activities, and you're so prone to getting even STIs. But I was so shocked because I wasn't sexually active. I just went there just to get information from them. So from there, I kind of felt really bad because I was really scared, and then I had to tell my mom. I explained it to my mom. And then after I explained it to my mom, she told me, don't really be scared. It might not even be what you're thinking. So just take heart. And then we arranged to go. We went to a private hospital they were welcomed, were given some brochures to read, and we talked to the doctor and did a couple of tests on me, and apparently it wasn't even cervical cancer, it was just infection because I was staying in school. So it was really so crushing when I went to the clinic, and all they did was just condemn us and not really shed light on what I wanted to know. I expected public health service providers to be more friendly and help us, because we need information from them. They know more than we do, so I was really shocked by what I got from them. I thought I would go there and ask questions and I'll be given the right services that I wanted, but after what I was told, I felt bad. And then now I try to encourage people, even though you can go to them and then they'll seem rude, but I think you just have to cooperate with them, just work on their terms, I guess. Then at least you get what you want. If you can't get it from them, probably consult somebody else or another person that you're really close to. I personally think being a health service, a public health service provider, is supposed to be welcoming and nice to everybody that approaches you. Because sometimes you might be really affected, even the way you go out, seek for help, and then somebody answers you so rudely. I mean, it really makes you feel more bad than you're feeling yourself. So I think they shouldn't be like that. They should be welcoming and nice. Because not everyone is close to their parents like that, and not everyone is close to their guardians or people that are keeping them like that. So if you can't talk to people from home and then you go there, they don't give you the right answers that you need, you end up making wrong decisions. You just go start thinking on your own, asking people who don't even know what it really is. They give you different advice and all that, and in the end it's just bad, and you end up making wrong decisions.
Well, that was quite interesting.
Yeah, wow. I mean, that was something. I'm just glad that she doesn't actually have cervical cancer, but even that thing of going on the internet, Googling symptoms, it's a very dangerous thing that I think we all fall into, because your mind will go crazy because there's always a million symptoms for like a couple of different things. Mm-hmm. So it's also just a shame that she felt, instead of being able to speak to someone at first, that she had to use the internet before she even went to a clinic.
Yeah, but I guess that's one of the challenges that young people are going through. And I think, like I had highlighted earlier, this is really one of the things that we're supposed to pick from the video, to see that young people are facing a challenge out there in terms of accessing information, or even just getting to a medical facility. Like going there easily, because instead of just walking there first, there are all these fears, and eventually that drove her to try and get this information off the internet. So certainly it's highlighting, I think, one of the biggest gaps that we still have as a country, and not only for the young people per se, but she highlighted that she was fearing to go there.
Yeah, she did.
For a number of reasons.
Surprising for me, or maybe not so surprising, but the fact that when she did actually go to the clinic, that the public healthcare provider, the nurse, was very, aggressive and mean about it, and accused her of all these things that she wasn't doing.
Yeah, making her fears a reality. How do I go there in the first place? She was already scared of going there. Yeah, and she finally goes there. She faces what you've just indicated, a hostile health service provider.
So what do we do about that kind of, how do we make it a place where the youth feels comfortable, or where there is no hostility? I'm sure, they're not trained to be hostile, so can you give feedback at your clinics? And
I guess the feedback is very critical, and looking at what she was highlighting, that's quite a big part of the feedback that needs to get to health service providers, because not so many young people will have a platform like the one she's been provided with to really come out and state what she stated. because you go there, you're judged that firstly you're already engaging in sexual activities, which she wasn't doing, according to her statement. But just because she knew that they would judge her even before she went there, she had to first go and Google cervical cancer without even really relating the symptom to the actual problem in the end. But I guess what was also really good is that she has a parent who was welcoming enough for her to walk to her and consult her on the next steps.
Yeah, and I mean, she did bring up such a great point, which was, even though it did take her some time to tell her mother, even when she told her mother, she was very calm about it and reassuring. And I think it's nice that she actually has a guardian or a parent who she can turn to. But we do have people who are, you know, orphans or vulnerable children who might not have those options, or maybe they're not that close with their guardians.
Yeah, exactly.
So I think her sharing her story, it's definitely going to help other people to try and have a conversation with someone in your life who's obviously a bit older, because sometimes talking to your peers can get you in more trouble or get you to worry even more so than you need to.
I think I like the fact that she actually highlighted that fact to say you end up getting the wrong information. Yeah. Which I think when we are young, most of us don't really look at it that way. So in a way, you find that going to the hospital or clinic is usually the last resort when you have reached a point where something is sort of like getting out of hand. Yeah. Not so many are as brave as she was. Because I think the other challenge that some other young people might have, like out there in the rural areas, they can't even Google this information. So if the clinics and the health facilities are not that accessible, it really shows that we still have quite a big gap out there. And I also like the fact that she did not only give advice to health professionals themselves to be more welcoming, but to the fellow young people to say, can we really ensure that we get the information from the right place, because we are going to share the wrong information if we are just talking amongst ourselves.
Yeah, that's very true.
Which I'm sure is a trend that you are witnessing also.
I mean, yeah, and even when I was younger, you ask someone a question, or maybe your friend wants to feel like they know everything. When you're a teenager, everyone feels like they know everything. Yeah. Maybe you read something or you saw a movie, now you know everything about it, you're the expert. So your friend comes to you, asks you a question. The advice that you give, it's not necessarily the correct advice or even the right thing to do, because you're not in a position where you've ever even gone through that. And I think, that's why things, especially when it comes to sexual reproductive health, it's very important that the youth understand their bodies and that they have access to healthcare providers who can help them. And I think also being a female, like gynecologists and things like that you should be seeing, but it seems like a lot of the stories I hear, I've got friends who only started seeing a gynecologist at 24 or whenever, or later after being sexually active, and that's something that's overlooked and I think needs to...
Yeah, very, very true. And as sensitive as the issue is, I think not much has been done, because I hear you're mentioning a gynecologist, and I'm really thinking again, how many young people have access to one in Zambia at the moment? Exactly. Yeah, so that's definitely quite still a gap. I know the government has put in place the Adolescent Reproductive Health Communication Strategy, which is supposed to guide not only the health providers, but also other organizations that work with young people in ensuring that they have access to the right information and are able to take the right steps with regards to their sexuality and their reproductive health life. Because when you look at young people's sexuality today, I think they face so many challenges compared to years ago, because I think in terms of the age of sexual debut has also been lowered.
Oh, kids are having sex younger.
Well, maybe we are getting statistics more easily now, but
definitely... maybe because maybe people aren't as shy about it as they were.
And so you did ask to say, how could we also make it a bit more friendly for the young people at the facility itself? Yeah. There is also one measure which is in place, which is the provision of youth-friendly services. There's some guidelines that are actually in place, and the guidelines really speak to health service providers on how they can engage with young people when they come to the facilities. which unfortunately, like Felistus already highlighted in the clip, is not always the situation. But as young people, we need to be brave enough to first take the step to go to the health facility. And when you get there, really work at trying to make sure that you get the service that you've gone there to try and access, as opposed to turning because the service provider looks hostile, or they looked angry, or they looked too busy for you.
I feel like I agree with you, but I feel like that's so much easier said than done when you're a 19-year-old girl or however old you are, and you're confronted with someone who is accusing you of sexual behavior that you're not even involved in, and being hostile. I mean, some people, I think you should try and fight to get the healthcare that you need, and you should stand up for yourself. But I also feel like some people, their personalities, they're just not, they're not fighters. So I do think there has to be a balance on both sides, where healthcare providers are not being dismissive, they're not being rude about things, they're not jumping to conclusions, and where also the youth are not feeling too shy or intimidated. So
to ask for what they need. Yeah, that reminds me, because I think as we worked with young people, especially in the past year, one of the young people gave an example of what they do when they are going to the health facility, and this is they would be going there to try and access an STI screening service, for instance, and they'll go there and they'll simply say, I have a headache, or I want to get a condom, something like that. They will not easily state what exactly they are trying to, what help they are trying to seek from the facility. So there's this part of being, I would call it judgmental on your part. So you're more like dismissing yourself even before you can approach somebody.
That's interesting.
Yeah. So definitely that is also a problem that can't be overlooked, in that it really has to be two-way. But for some service providers, I think a good number of them have actually been trained to try and detect,
to get the information out of
like what really is this young person, like by looking at them in the face and seeing, are they really saying what they want to say, or they are quickly turning around because they've come to a health facility and they've seen somebody they know in the community, so they quickly want to U-turn, but in the end they ask for a service that they are not really even in need of, and they just go away if they are given the Panadol, say. But that's not the service the young person wants.
And that's very dangerous, because long-term effects of whatever you are going through, if you are sick, delaying treatment because you're too shy and someone else didn't detect, and you're too embarrassed by someone in your community seeing you, that's very dangerous for your own body.
Yeah. I think another thing that I noted from her closing point was the fact that she was not regretting the fact that she was brave enough to still go ahead and go back to get the mom's support. And like you've highlighted, if young people have that as a challenge, it would really help to say they have that rapport within the communities where they are coming from, a support system, a starting point to say, if I'm not brave enough, which I know even myself, I'm sure I was very timid when I was young.
Yeah.
Yeah, so brave enough to have somebody I could ask at that level.
Yeah, I think it does also have to be, it's not just even in your family home, it is about the community, because as you've said, if you don't feel comfortable to speak to anybody, you're going to end up using the internet for your resources, asking your friends for their their so-called medical knowledge that they don't actually have. So yeah, it is very important to start that conversation in the community and the dialogue between the clinics and even the community people.
Certainly.
So you say, we're here to support, we're not here to make anyone feel ashamed. Yeah.
And I think for the young people, another key factor that they need to really understand, that it's not always somebody who's an adult, in the sense that they are much, much older than you.
Yes.
I could be 18, there's somebody who's 20, definitely that person could know more. I could ask their help for their help, because the other thing is we do have a lot of other peer educators there. You've already shown you are one of them, and if a young person was brave enough to just walk up to you and say, oh, I see you here all the time, and are you able to assist me with information? I don't think a lot of young people are taking that step to just talk to their fellow young people who are volunteering out there and working closely with their health service providers to give out accurate information. I'm not seeing much of the walk-ins going in from the work we've done, but in many cases you have to organize an event and try to, which shouldn't always be the case, because those events don't take place all the time. But the young people that are there to give information are always in those communities, and they can always support on a continuous basis. Your final thoughts, any final thoughts about the video clip?
Well, I'm really impressed by the fact that she's brave enough to speak about what she's gone through and share this information, because I feel like it's going to help someone else, either in a similar situation or just to help someone to know that it's okay to ask for help and that it's okay to go into the clinics and be more demanding of the service that is something that should be provided for you and is there to be provided for you. I think she's definitely a brave girl. And yeah, I don't know if I was the same age, if I would have been that persistent in order to get the help that I needed.
You would have gone back to Google.
I'm not sure what I would have done.
No, don't.
No.
That is definitely something that they shouldn't be doing, like you already highlighted, yeah. We need to get the information from the right places and from the right people, actually. I think that's more critical. And the fact that you mentioned that she was very brave also, I would try to highlight the issue about being, I think you'd call it self-stigma, not stigmatizing yourself as a young person.
Yeah.
Yeah, because if you're going to do that, you're definitely going to fail to take the right steps. You will always fall short of what you really need to try, and the help you're really trying to get, or the service you want to access. So that aspect, I think, for young people really needs to go away. For as long as you know yourself, you know what you're engaging in, and you know that this is about your health and nobody else's, it's all about the young person also taking responsibility. But also, I think I'm an adult.
Yes.
Us as adults, I think not being so judgmental, because if we are going to judge every young person who comes or approaches a health facility before we can even talk to them, then we are going to send them away, and we'll keep sending them away. Because I know, like I highlighted, we have guidelines already in place to help us take them through step by step. Because even if they come and ask for a condom, sending them away won't sort out the problem, but it's ensuring that they get the information they need on how to use that condom correctly, and if they are underage, you also counsel them through that process to say they are not supposed to be engaging in sex. So you give them the full package of information from the facility.
Well, I think it's all kind of started here with hearing her testimony and then us having this conversation as well.
Yeah.
As long as we keep talking about these issues, hopefully one day this kind of situation is going to be a non-issue and not something that you have to hear about. Hopefully one day both sides of the system are going to be working coherently together, yeah.
Yeah, exactly. We are going to get there. A lot has already been done. When you have the guidelines in place, when you have a government that is supporting adolescents through and through, then definitely we are going to get there. We just need to keep talking and engaging the young people.
Well, thank you for having this conversation with me and sharing that video.
Yeah, it's been a real pleasure. As expected. The closest I could get to a celebrity. It's been a pleasure having this discussion with you.
Thank you so much.
After sharing my story, I was kind of happy because I thought I think I've helped some people who've been holding back what has been wrong with them. So yeah, I was happy. At least I got something off my chest like that. Yeah. I think I've become more cautious with everything that I do. Yeah, at least I try to do what's right, abstain, and also trying to encourage other people who are going through the same things. Yeah, talk to them and encourage them to talk to people that they trust like that. Yeah, not to be discouraged by other people that don't want to help them, because there are people out there who want to help them. So yeah.